A vaginal ring is a small, flexible, hormones-releasing device used as a contraceptive. It is inserted into the vagina where it releases hormones, usually estrogen and progestin, to prevent pregnancy by stopping ovulation and thickening cervical mucus, making it harder for sperm to reach the egg. The ring is typically used on a monthly cycle, offering convenient and effective option for birth control. To use vaginal ring, the woman must first wash her hands and find a comfortable position, squatting or lying down. She then squeezes the ring between her thumb and index finger and insert into the vagina as far up as comfortable. The ring should be left in place for 3 weeks and then removed for the 4th week to allow for menstruation.
Vaginal rings are generally suitable for most women seeking hormonal contraception, especially those who prefer a low-maintenance monthly option. They are commonly recommended for women who are in good overall health and can safely use hormonal birth control. Desire an alternative to daily contraceptive pills. Are non-smoker or under the age of 35, smoking and age can increase health risk with hormonal contraception. Are comfortable with using internal contraceptive devices. However, vaginal rings may not be recommended for individuals with certain medical conditions, such as history blood clots, certain cancer, or severe migraines with aura. Consulting a healthcare provider is essential to determine if the vaginal ring is an appropriate and safe choice based on personal health history and needs.
The vaginal ring is a form of hormonal birth control that offers several advantages for contraception and menstrual cycle management. Here's a more detailed explanation of the points you mentioned. Effective. The vaginal ring is over 90% effective at preventing pregnancy when used correctly. It releases hormones, estrogens, and progestins into the bloodstream to inhibit ovulation, thicken several mucus, and thin the lining of uterus, making it difficult for sperm to enter and for a fertilized egg to implant. So this effectiveness can provide peace of mind for users. So convenient. The vaginal ring is designed to be inserted into the vagina and left in place for 3 weeks, followed by a 1-week break during which a withdrawal bleed, similar to a period of hours. This monthly usage is convenient compared to the daily oral contraceptives, as it reduces the likelihood of forgetting to take a pill each day. Woman can insert the ring, set it, and forget it for weeks at a time, which can be especially beneficial for those with busy lifestyles. So, menstrual cycle control. The hormonal release from the vaginal ring can help regulate a woman's menstrual cycle, making periods more predictable. Additionally, it may alleviate common symptoms associated with menstruation, such as painful cramps, dysmenorrhea, and heavy bleeding, menorrhagia. Many users report lighter periods and a reduction in the severity of symptoms, leading to greater comfort during their menstrual cycle. So overall, the vaginal ring represents a practical and effective option for many women looking to manage their reproductive health and menstrual symptoms. So that is the advantage of the vaginal ring. Thank you.
The vaginal ring is a form of hormonal contraception that it is placed inside the vagina to release hormones that prevent ovulation. While it has many advantages, there are some disadvantages to consider. First, initial discomfort. Some women may experience discomfort or irritation upon insert of the ring. It can take time to get used to it. Potential for displacement. The ring can become dislodged or pushed out of the vagina unintentionally, which can reduce its effectiveness. Second, hormonal side effects. Like other hormonal contraceptives, the vaginal ring can cause side effects such as nausea, headaches, weight gain, mood changes, and breast tenderness. Third, risk of vaginal infections. Some users may experience an increased risk of vaginal infections or irritation, particularly if the ring is not used or cared for properly. Fourth, must be replaced the ring to be replaced monthly, which may be seen as a drawback compared to other long-term forms of contraception such as IUDs or implants. Lastly, health risks. There are potentially health risks associated with hormonal contraceptives, including an increase, and that is the disadvantage of the vaginal. Thank you.